So hello, everyone, and welcome to the Stakeholder Engagement webinar series. My name is Alison Heinrich. I use she, her pronouns, and I'm a manager on the Health Systems Integration team here at NASDAD. Just a few housekeeping items before we begin. We ask that you please stay muted, and if you have any questions, feel free to write them in the chat, and we'll save some time at the end for any questions. Finally, this webinar is being recorded, and we'll share the recording and slides with you all after this session. Next slide, please. So just a quick disclaimer, this project is supported by HRSA as part of a cooperative agreement and does not necessarily reflect their views. Next slide. So here's the agenda for today's session. So first, we're going to start with an overview of NASDAD and the EHE SCIP team. Then we're going to quickly recap the 5 intensive TA sessions that were hosted with 43 of the 47 EHE jurisdictions and some of the themes that emerged during those sessions. We'll then summarize the importance of community engagement within our EHE programs, and then we're going to hear from 2 of our fabulous presenters. So first, we're going to hear from Jose Aguilar with Aguilar Salud around his experience and recommendations for engaging people of lived experience, particularly from the Hispanic and Latinx communities. And then we're going to hear from Heather Shoup at Clark County, Nevada, who will share their community engagement plan and how they've really engaged people of lived experience into their EHE programs, along with best practices and recommendations. We will have some time at the end of the presentations for some questions, but then we're going to move on to monitoring and evaluation and summarize some strategies on how we can engage people of lived experience into our monitoring and evaluation plans. And then we're going to have some time for a large group discussion so we can have some peer-to-peer learning and hear how you all are engaging people of lived experience and about your successes and your challenges and have some time to learn from each other. And then finally, we will wrap up and share some next steps. Next slide, please. So some background on NASDAD, if you aren't familiar with us, we are a nonpartisan nonprofit association that represents public health officials who administer HIV and hepatitis programs in the U.S. We serve governmental public health agencies across states, territories, and local jurisdictions, and we do this work by strengthening governmental public health through advocacy, capacity building, and social justice. Next slide. So the EHE SCIP, or the Systems Coordination Provision Team, we provide technical assistance around the integration of healthcare services. So looking at all the different players in our healthcare delivery system, including payments such as private insurance and Medicaid. But these are some examples of the TA we provide, and that includes some leadership development opportunities, learning collaboratives, communities of practice, and peer-to-peer learning. And our areas of TA expertise are listed on the bottom, which include data sharing and integration, program policies and procedures, procurement, subrecipient monitoring and program evaluation, developing innovative programming for key populations, and stakeholder and systems level engagement. Next slide. So here are the friendly faces of our team. So please feel free to reach out to any of us at any time with any questions or TA needs. We're excited to work with you all. Next slide. So between September 2023 and March 2024, NASDAD, along with our partner CAI, hosted 5 intensive technical assistance sessions, and we had 43 out of 47 EHE Phase 1 jurisdictions attend. So the jurisdictions identified strategic initiatives that are achievable and will have the greatest impact to focus on in year 5 of EHE. So some of the common themes from the sessions that we found were around stakeholder engagement, clinical innovations, and data monitoring and evaluation practices. So this webinar series is in response to the stakeholder engagement theme, and we hope to provide you with tangible and actionable information today that you can take back to your jurisdictions. Next slide. So we examined the most common requests for TA in the stakeholder engagement category, and we divided them up into 4 sections, which are engaging legal and immigration systems, engaging people of lived experience, engaging clinical systems, and engaging faith-based communities. So last month, we kicked off with a webinar around engaging immigrants, and today we will be focusing on engaging people of lived experience. And then our next 2 sessions in this series will focus on clinical engagement and faith-based communities. During these webinars, we will be highlighting best practices, successes, and challenges of EHE jurisdictions who have had successes engaging these populations and facilitate peer-to-peer sharing as well. Next slide. So before I turn it over to our presenters, I wanted to share a bit of information around the importance of community engagement within our EHE programs. Since the start of HIV, communities, they were really at the forefront, organizing and advocating for HIV prevention and care services. And this community involvement continues today and is really a pillar of the work that happens in HIV. So as jurisdictions work to execute and update their EHE plans, it's essential to engage our communities to inform and guide our plans. These EHE plans, they are for communities, they are informed by our communities, and they are led by our communities. And community engagement can work to do several things. So first, it addresses a need in the community. It can improve people's health. It can really work to empower those, especially those who lack power, to gain control over their health and feel confident in their decision-making. And community engagement is really focused on enhancing relationships, and it's focused on commitment to communities. So I want to mention that community engagement should be an ongoing process that is continuous and focused on trust building. It does not end when a grant cycle ends, and this relationship shouldn't be transactional. It should be purposeful and really focused on building relationships, especially when we're engaging new communities or engaging those communities who they've experienced harms in the past and might be mistrustful of us. It's really important to make sure our work is guided by our communities, and that includes people of lived experience. So next slide, please. So now I would like to introduce Jose Aguilar, who's going to share a bit about himself, his life experiences, and how we can more effectively engage people with lived experience. So Jose, I'd like to turn it over to you. The floor is yours.
Thank you very much, Allison. It is a pleasure for me to be here. Hello, everyone. My name is Jose Aguilar, and I'm deeply honored to be here with you today. And I'm here as a proud Venezuelan immigrant, a cisgender gay man, and someone who has been living with HIV for over a decade. My journey has shaped who am I today, both personally and professionally. And I have dedicated my last 11 years to the fight against HIV discrimination, stigma, and so many issues. I have been supporting the most vulnerable communities, particularly LGBTQ plus individuals, immigrants, women, and Hispanics. Through my roles at Pineapple Healthcare and as the founder of Aguilar Salud, I've been at the forefront of creating programs and initiatives that aim to re-engage patients in care, improve treatment adherence, and promote HIV prevention. I've been also, you can go to the next slide, please. I've been also a CDC ambassador for the Let's Stop HIV Together campaign, and I have been also participating with the pharmaceutical industry and also working with the American Academy of HIV Medicine and the National Hispanic Medical Association. My life journey, you can go to the next one. My life journey took a significant turn when I was diagnosed with HIV, and this moment was transformative. It challenged me to rethink everything I knew about health, community, and my own identity. Rather than letting this diagnosis define or limit me, I decided to use it as a catalyst for change. Over the years, I've developed a deep understanding of the social determinants of health, especially as they relate to marginalized communities. These experiences have fueled my passion for ensuring that no one has to navigate this journey alone and that everyone has access to the care and support they need. The next one. In my experience working with diverse communities, I've seen how deeply cultural norms and social attitudes can influence health behaviors. And for instance, in many Hispanic and immigrant communities, traditional gender roles and religious beliefs can create barriers to seeking care or adhering to treatment. Machismo, for example, often discourages men from discussing their health issues openly, while Marianismo pressures women into prioritizing family over their own well-being. Language barriers further complicate these issues as many patients struggle to communicate effectively with healthcare providers. And this is why it's essential that we, as healthcare providers and people involved in healthcare, cultivate culturally competent environments where language is accessible, beliefs are respected, and patients feel understood and supported. We can go to the next one. Health literacy is an area that cannot be overlooked when discussing patient re-engagement and treatment adherence. Many of the patients I work with, particularly those from immigrant communities, have limited understanding of the healthcare system. This often leads to confusion, miscommunication, and ultimately non-compliance with treatment. I want to take a pause here to share with you all something that happened with a patient today. The patient called me saying, "Thank you so much for my medications. I never received them." And after doing a quick investigation, the pharmacist sent a text message to the patient in English, a patient that just came from a Hispanic country. And the pharmacy was expecting the patient to reply a message for the medication refill. So they were in the air, and this is why taking these conversations is very important. For instance, a patient might not fully understand the importance of taking their HIV medication daily, or they might miss appointments because they don't grasp the severity of their condition. Our role as healthcare providers is to ensure that we are communicating in ways that our patients can understand, using clear, simple language and provider education that empowers them to take control of their health. By improving this health literacy, we can significantly enhance treatment adherence and overall health outcomes. Next one. And I'm going to be answering any questions. Right now, I'm kind of going over what I put together for you all because I want to make sure that I am compliant with time and everything. So thank you so much for your patience. Identity is deeply tied to how individuals experience the world, and unfortunately, certain identities often lead to social exclusion. LGBTQ plus individuals, immigrants, and people living with HIV like me are all too familiar with the sting of discrimination. Fear of judgment or rejection can prevent them and all of us from being open about our sexual orientation, gender identity, or our HIV status, even with the healthcare providers, because sometimes a healthcare provider can be talking to us from their own personal experiences. We all know this should not be the case, but still happens. This fear is compounded by the challenges many immigrants face, including fear of deportation and a lack of understanding of their rights. As a result, these individuals may avoid seeking care altogether, leading to poor healthcare outcome. And we must create safe, inclusive spaces where patients feel comfortable being themselves, because we need to make sure that we also take care of the community health. Taking care of our patients, we're taking care of the entire communities. Next one, please. The impact of social exclusion goes beyond the individual. It also affects the entire community. When people are marginalized because of their identity, they are denied access to opportunities and resources that are essential for their well-being. This perpetuates a cycle of inequality that is difficult to break. For example, a person who is excluded from healthcare because of their HIV status may also face economic hardship due to job discrimination, which in turn affects their mental and emotional health. As stakeholders in this healthcare system, it's our duty to address these systemic issues by advocating for policies and practices that promote inclusion and equity. And by doing so, we not only improve individual health outcomes, but also contribute to the overall health of our communities. Like I just said, please, the next one. I'd like to share with you all the different affiliates that I work with. I am the founder of Aguilar Salud, which is a nonprofit working for the Hispanic community. We make sure that we have all the information 100% in Spanish. There's some organizations that work Spanish and English, but we here in our community, we're in Orlando, Florida, and we're trying to make programs for the entire country. We do everything in Spanish only. I also work with Pineapple Healthcare, addressing healthcare disparities by providing primary care, HIV treatment, PrEP, hepatitis C treatment, STI testing, mental health, and some other programs. Also, we Detengamos Juntos el VIH. This is the CDC campaign for Let's Stop HIV Together. And we're working to disseminate the message of HIV prevention and all the services that you all also provide in your communities. And of course, with NHMA and the American Academy of HIV Medicine, we're making sure that we put together all the ideas that we have in the country to better serve the communities. And in the next one, sharing with you all my information. You can follow me on social media. And if you have any questions, please feel free to let me know. I will be more than happy to collaborate, make material in Spanish for your communities, or also share what we're doing. And I would love to see and to know at the Q&A or any comments what the different organizations and representations are doing for their own communities, for the Hispanic communities. Thank you so much for your attention. And then I'm going to give it back to Allison.
Thank you so much, Jose, for sharing with us. And thank you for being vulnerable with us and sharing your story. That was really powerful. So just really appreciating that. We will have time for questions at the end. So without further ado, if we could go to the next slide, I would like to turn it over to Heather, who's going to be sharing the great work they're doing in Clark County, Nevada. Heather, the floor is yours.
Thank you. Thanks, Allison, for inviting me to be a part of this discussion today. Community engagement is one of my favorite things to talk about. And I see so many ways that this is being done across the country and also ways that we can do it even better. Next slide, please. So this is just our support. We created this PowerPoint and presentation through our EHE funding. Next slide. So again, my name is Heather Shoup. I am here representing the Las Vegas Transitional Grant Area. So I serve as the project director for our Ryan White Part A grant, our Minority AIDS Initiative, Ending the HIV Epidemic, and Status Neutral. So I'm representing the recipient's office. And what I'm going to be talking about are some of the ways that we think and how we interact with community and how we ensure that there is a meaningful seat at the table for people with lived experience. Next slide. So the first thing I want to talk about is how we think. So one of the things that we talk about here in the office is this notion of nothing about us without us. This is a slogan that was born out of the disabilities movement in the 1990s. And what this really meant was that policies and programs shouldn't be decided by people without participation, active, direct, full participation from people in the communities or in the groups that would be affected by that program or policy. Today, that extends to other marginalized groups of people, youth, suicide attempt survivors, people with mental health challenges, and of course, we've extended it to people with HIV. I would say, when we're thinking about community engagement, it's really not just a skill set, it's a mindset, and I also like to say that it's a heart set. It's something that we need to keep front of mind and front of heart, that we need people with lived experience to share their experiences bravely with us, like Jose just did, and to tell us how we can do things better. So it's about setting our egos aside and knowing that we can always improve, and our folks with HIV are going to be the ones that can tell us how to do that. When we're doing community engagement properly, it really fosters a spirit of collaboration. It facilitates innovation because it minimizes the fear around making mistakes or not knowing something. And it also facilitates better outcomes because it minimizes the shame about asking for support. And finally, it also ensures that we're using funds properly for what people truly want and need. And what this really elicits for us is co-creation with community. So we do involve our subrecipients and other community partners. But if you were to look at one of the slides I took out yesterday, is a list of our relationships with people in the community. And at the top of that list is people with lived experience. Those are the folks that we always want to keep top of mind. Next slide, please. So now I'm going to talk about some of the ways that we have integrated community engagement and really brought people with lived experience into all of the work that we do. So first, I'll backtrack about a year. We've been looking at case management across our system here for the last couple of years. And we really see some places where, although it's working, we see a lot of places where it can work better. So as we were really looking at developing this contract and bringing on a consultant to lead our community through this change process, it was really important to us here at the Office of HIV that people with lived experience and service providers were a part of these discussions and the decision-making and talking about what's going to work better. So through the consultant that we brought on to do this work with us, we asked them to create a community advisory board. So the community advisory board is comprised of people with lived experience and also local community partners and service providers. And this community advisory board is really informing the case management redesign for our entire system. They're also working on a program called Skills, Education, and Empowerment for New Patients. It's called SEEN. And this is a new initiative through our Ending the HIV Epidemic dollars, which is really like what we were previously calling it was Newly Diagnosed University. So essentially, it's an online university-based program, which provides education to people who are newly diagnosed. So they are our people with lived experience. Our entire community advisory board is helping to inform SEEN and also piloting it so that we can make sure that all of the kinks are worked out before we roll it out to community. So that's some of the things that that the community advisory board is doing. And what was beautiful about being able to do this through our consultant is that they were able to bring our folks with lived experience on as consultants and to be able to pay them commensurate with the value and the education and the experience they're bringing to the table. Next slide. So next is P3. This is our People, Purpose, Power Learning series. And this is something that we've done every year since the first year of Ending the Epidemic. So the first year we started with an HIV Leadership Academy. And this was made up of staff from local service provider agencies, but about 40% of the cohort were people with lived experience from our programs, from our planning council, from other parts. So we had a cohort of youth from the Part D program, and they were all able to go through this HIV Leadership Academy together. Many of them have moved into positions with subrecipient providers. They are in the planning council. They're working through other things as well. So that was one of the first places we started with People, Purpose, Power. This is also something that the Community Advisory Board helps to inform. So every year we want to like kind of find out what the community needs, what they want to see in terms of training topics, what people with HIV think their service providers need to learn, and also what they want to learn. So as a result of that feedback, we've been able to provide lots of different types of training. So Leadership Academy was the start of it. We have done trainings on integrating HIV and STI prevention into primary care. We've done some things directly for people with lived experience, so empowering the HIV community and really teaching strategies for education, engagement, and self-advocacy. We've done some population-specific trainings around gender expansive individuals, Latino gay men and bi men, transgender and gender nonconforming folks. So we've done lots of different trainings that have been directly informed by the community. The other thing that we are recently started doing is cultural humility. So this is an in-person training program that was developed by a couple folks out of UCSF. And they were just down here to provide, they've been down here twice now to provide the training. But in the training that we did in June, we also trained, I think, 10 other trainers. So now we've got a cadre of trainers across the community that are going to be able to teach other folks about cultural humility. And the Planning Council was a part of that training as well. Next slide, please. So next is Project Home. Project Home is another new EHE-funded initiative and program. This is a developmentally appropriate program for 18 to 26-year-old young people with HIV. What we were finding was that looking at the data, we were seeing a lot of young people kind of end their pediatric medical care, moving into the kind of the adult system of care, which has lots more moving parts to it a lot of times, lots more services, more things to have to navigate. And we were finding that we were losing some of those young people in that transition. So we wanted to create a program. We went into partnership with Part D and really worked with their young people to host some focus groups so that we could hear directly from those young people what they wanted to see in a program and what would help them to stay in care. So we got our first client in Project Home about 15 months ago. There are over 20 clients in the program now, and all of those young people are virally suppressed. So, and they continue to integrate the feedback of those young people as they continue to build the program. Next slide, please. So this is our Love Live campaign. This is a social media campaign around the concept of U equals U. So in 2022, we were really looking at wanting to talk more about U equals U and really spark the local conversation around undetectable equals untransmittable. We met with a diverse group of people with HIV to learn about their perceptions and their understanding of U equals U. And many of them during those focus groups voiced that learning about U equals U had been so transformative for them. That U equals U, these are direct quotes, U equals U is all about taking care of the inside of you, your mind, your body, and your well-being. By keeping HIV to undetectable levels, you cannot transmit HIV to partners, and you can love more openly without fear. So these words were taken literally to develop a comprehensive media initiative called Love Live, which is designed to educate people with HIV and the public about the significance of undetectable equals untransmittable. The campaign also promotes the availability of Ryan White funded HIV care and supportive services that can help people with HIV to attain and maintain viral suppression. The campaign materials feature people with HIV that are all local, celebrating the excitement and the freedom of U equals U. The colors are vibrant. It's an affirmative sex positive campaign that's available in English and in Spanish and has been on, we have a website, which I think Allison will share with you. We've got an English and a Spanish version, posters, bus ads, billboards, social marketing, campaign influencers, and collaborations with other organizations that touch the populations that we really want to get this message to. So our Love Live talent is made up of 12 local folks, most of them living with HIV, one person who is an ally. Amongst those 12 people, 75% are people of color, 33% are over the age of 50, 4 are cis and transgender women, and 6 are men who have sex with men. So it's a really it's a really good cross-section of what HIV looks like in our community, and has really, really been powerful in sparking that local conversation. We've been at it for almost 2 years now, and the conversation continues to broaden and get louder and get stronger. And people with HIV, our people with lived experience, have been a huge part of that. Next slide. So clinical quality management, again, if we go back to what the meaning is of nothing about us without us, we shouldn't be doing anything without the input of people with lived experience, including the design, the development, the implementation, and the evaluation of programs. So that's where clinical quality management comes in. And we're very intentional about inviting clients to planning council, to clinical quality management activities. And so this is a community engagement video, again, also available in Spanish on our website. And if somebody could hit the play button, that would be wonderful.
Hi, this is Jessica Rios, your Las Vegas Transitional Grant Area, Ryan White Part A Clinical Quality Management Committee Chair. I want to welcome you to our CQM quarterly meetings. Our time together with providers and other community stakeholders is a great way to connect. Our committee is a safe space and a welcoming place where consumers can ask questions, offer answers, participate in satisfaction surveys and focus groups to help us deliver optimal outcomes for supportive and core medical services. Your input, experiences, and point of view is necessary and welcome. Our vision is to deliver a quality improvement system that provides resources and capacity building to subrecipients to help guide, shape, and enhance the delivery and quality of care so they can make a positive difference in the lives of persons infected and affected by HIV. Together, we can identify opportunities to address gaps and barriers to improve outcomes along the HIV care continuum through a comprehensive and coordinated approach. We are looking forward to connecting with you at our quarterly CQM committee meetings. I'm available at jessica.rios@clarkcountynv.gov. See you soon.
So this is a video that's available on our website. We've shared it with Planning Council, and we do have a handful of folks with lived experience that attend our CQM meetings now as well. Next slide. All right, and so other engagement. So we are a part of community events pretty often, usually as a result of an organization wanting to connect with the Love Live campaign. So we invite folks to community events with the Office of HIV, and typically, like, we will ask folks, and we will ourselves do tabling, but we don't ask them typically to do it for more than 30 minutes to an hour, and then we all have a chance to enjoy the event together. So some of the events over the last year or so have been the Human Rights Campaign Gala, the Public Education Foundation Black Girl Magic Juneteenth Jubilee, the AFAN Black and White Party, and then RuPaul's Drag Race Live. So one of our Love Live influencers, actually two of our Love Live influencers are RuPaul's Drag Race queens, and they invited us to come to a performance of RuPaul's Drag Race Live. You can see all of us in our t-shirts there. A lot of our Love Live talent is there, some of our influencers and some of our staff. And then we also sponsor Planning Council members to go to conferences like USCHA and Ryan White. So next week at the Ryan White conference, we'll have 3 of our Planning Council members in attendance. Around this time last year, we sent 4 people to USCHA. So it's really important that we continue that relationship with our people with lived experience, that we invest in folks. And what we've seen over time is that we have better ideas, we have better programs, People with lived experience have an opportunity to learn more and to move up in their positions, and to really get involved and to self-advocate and to be involved in community in new and different ways. Next slide. So if anybody has any questions, they would like more information, want to talk through strategies, feel free to reach out and contact me. Again, it's one of my favorite things to talk about. I'll see you at the Ryan White Conference next week, and I'll turn it back over to Allison.
Thank you so much, Heather. You all are doing such amazing work in Clark County. I'm honestly just blown away. Thank you for sharing with us today. If you go to the next slide, please. So now we do have time for some questions for both our presenters. So I would encourage you to use the chat function, drop your questions there. My colleague Sarah will read those out as they come in. But while you all are thinking, I actually do have a couple questions. So the first one is for you, Jose. From your perspective, what recommendations would you have for health departments and jurisdictions who are looking to engage people with lived experience for the first time, particularly if it's someone who is new to this country or might speak another language? Where do you suggest that they start? How would you want to be approached if you're in that situation?
Thank you. Yes, I see that it will be very important for us to trust whoever is reaching out and whoever is the person that we can make contact with at the health department. And there's different activities and of course cultural approaches. We as Hispanics and Latinos, we like to have different encounters. We do everything over food, over dinner, over music. For example, with Aguilar Salud, we have a program that is called La Cena, and we do a monthly dinner with music and food, and then we do tabling with different organizations that are in the community. All their services are in Spanish, and we have HIV testing, mental health services, HIV services, PrEP services, primary care, immigration, everything. Everybody comes to the table because they want to have fun and they want to, have a good time. And there is when they find the resources and, oh, this is available for me. I don't need immigration status. I don't need health insurance for this. I can get access to treatment. I just got into this country and I thought that it was so expensive that I could only get it from my country. So there's different approaches. I will say that the first thing is having people that look like me. That's why having on your board of directors, your your CAPs and your groups, support groups, peer navigators, case managers, executive positions. If you have people of lived experience, transgender individuals, people that is Spanish speaking as me, because with my Venezuelan English, perhaps I'm going to struggle to communicate with a person just in English. But if they speak Spanish, it's going to be way easier for me to express all my healthcare needs and all the struggles I'm going through and how I can get better assistance. I think that meeting people where they're at and looking, as they are with the real people we have in our communities, I'm pretty sure that we can get there with, and this is just some of the ideas that we have, but there's many more. Thank you.
Thank you for that. Yes, I feel like really good food, a good atmosphere that is so inviting and that works, just a place to wind down and have fun and kind of take the pressures off. So thank you for sharing that with us. Heather, I do have a question for you. You mentioned that you were able to hire people of lived experience as consultants so you could pay them. What was that process like? What kind of approvals did you need? Did you have any pushback? Anything you could share in case other jurisdictions here are thinking of doing something like that? You're on mute.
Got it. You'd think I would know that by now. So with our case management redesign, we put out a request for quote to, I think, 6 different consulting agencies across the country. And in the scope of work that we developed, that they had to respond to is how they would develop a community advisory board that is made up of people with lived experience, and how they would compensate them. So, you know, we've got lots of folks with HIV, lots of people with lived experience that are part of the program that are also working for subrecipient agencies. And so there's no problem paying them as staff. So bringing them on as consultants through our contractor was also not a problem. It wasn't anything that it wasn't anything that we asked permission for, because there's already precedent for that being done as people with HIV are working for subrecipient locations. So that hasn't been an issue. If it becomes one, I will definitely let you know. But one of the things that I was saying when we were preparing for this webinar last week was, I'm not about pizza and a gift card. I think that is poor compensation for somebody sharing some of their most intimate, vulnerable information and experiences. And so we have to find ways to think outside the box, to utilize other grant funding, to utilize other unrestricted funding, to be able to pay people commensurate with their experience and what they bring to the table.
Absolutely. Thank you for sharing that with us. And I'm glad to hear you haven't had any pushback. That gives me a lot of hope, and maybe other jurisdictions can start doing that as well. Just want to do one quick last call for questions before we move on. Is there anything in the chat, Sarah?
Nothing yet, but I'm keeping an eye on it.
All right. Well, if any questions do come up, definitely put them in there, but we are going to go ahead and keep moving forward. Zoe, next slide, please. All right, so now we're going to pivot a little bit and talk a bit about monitoring and evaluation, and how can we meaningfully involve people with lived experience into our monitoring and evaluation plans. Really, it starts, from the very beginning, making sure that we are involving our communities in every step of our program planning from the start, and keeping them at the table with us to really guide and inform and plan our activities, as well as providing space for discussion and dialogue. And when you're providing space, I think depending who you're engaging with, which communities you're engaging with, you might need to look to go outside of your physical space. So for example, if you're engaging people who might speak Spanish as their first language, have someone on staff or a trusted community champion who could facilitate that meeting in their native language. Look to hold your space, in a community center, or, anywhere where the community is already gathering and has good rapport with and feels safe. So really just making sure you're creating that space where they're comfortable engaging and sharing their feedback. Also, if you're collecting and processing any data, making sure that you're doing that in a timely manner and sharing this back with your community. I know back in my CBO days, sometimes we heard whenever we did feedback surveys or town halls, we would hear sometimes, well, I gave you my feedback, but I don't know what's done with it. So, just being mindful of that and really looping in your communities with how that information is being used and keeping them informed and up to date. And even not just informed, but working together, kind of like how Clark County, they co-created these programs with their communities, right? So really empowering them to take charge of these programs. And also when you're collecting data and feedback from your community, it's important to be transparent with how that information is being used. And I say that because depending on what kind of data you're collecting, surveillance, it can be really triggering for some communities. So if you are collecting data that, gives people pause, you want to be really honest and transparent about what exactly it is that you're collecting, why you are collecting it, what is it being used for, who has access to that, and just being, very communicative and open and transparent and honest with them, and really, creating that safe space, and also being okay with receiving any critical feedback or any negative feedback, and being able to really take that to heart. Because I think it was Heather who mentioned this is hard work. So it's really important to keep your communities at the forefront, and really take what they say to heart, even if it might not be something we want to hear. And again, continuous communication and transparency is key, making sure that you are communicating with your communities through multiple different methods, in person, face-to-face. If you have like a Discord or any other sort of online platform, newsletters, it could look you could communicate through various different ways and being transparent the entire time and just really working hand in hand with your communities. And again, focusing on relationship building and trust building and making sure that this is a continuous process that outlives EAG. Next slide, please. And now I would really love to hear from you all who are here today. This is some time we have to hear what you all are doing, hear about your successes and challenges, be able to brainstorm with each other. So we do have a few questions. So first, how are you engaging people of lived experience in your EHE programs? What successes have you had with engaging people of lived experience? What challenges exist and how can we overcome them? And then how are you currently involving people of lived experience in your monitoring and evaluation framework? So we would love to hear from you. You certainly don't have to address all of these questions. You can answer just one. We also don't want to pressure anyone, so you can definitely utilize the chat and share your experience with us, or we would love if we had a couple brave souls who wanted to come off of mute and speak with us. But yeah, I'm going to stop talking now and open it up to everyone in the room. What successes and challenges have you had? How are you involving people of lived experience in your programs?
I guess I can go. Hi, everybody. My name is Manuel Antunes. I am from Orange County, California. And I am new to my position. And I just want to thank Heather and Jose for their words of wisdom and sharing their successes and what they do. As I mentioned, I am new to the team here in Orange County. And so I'm pretty much joining this call to kind of take some ideas, and I'm putting together some strategies as well to engage people with lived experiences. I would love to connect with Heather at the Ryan White conference. So I'll look out for you. But I have no successes yet, but I'm in the planning process. So thank you so much, and just wanted to say thank you for holding this space.
Thank you for sharing with us and welcome. I hope it's been a great onboarding for you so far, and looking forward to hearing that you're going to be at the Ryan White conference. Sure a lot of people on this call will be there. And the successes are to come, so we can't wait to hear that in the future from you.
Thank you.
Is there anyone else who'd like to share with us? I know usually when I ask about challenges, everyone loves to talk about challenges.
Hi, this is Rose from Bexar County, Texas. So one of the things that we have in our EHE program, which what we call is Operation Brave, but one of our programs is the peer program, and that is a combination of individuals who are living with HIV and a combination of those that are not living with HIV but have been impacted by a family member or friend. And so it's a peer program of 18 to 29-year-olds. And what they do is they provide education, awareness, removing stigmas. They are utilized at some of our community events that we are a part of, whether we are hosting them ourselves through our university health, or some of the city events that we may have going on, like during Pride Month, during Fiesta, which is one of our biggest events in San Antonio, Texas, in April. It's like a whole 2 weeks of nothing but partying, but we do table at those events and a bunch of other ones. So that's one way that we do utilize lived experience. I know another thing, what we do every year in October is we host Operation Brave, host a huge event. It's called A Day to Be Brave. And so it's a big event, and it's specifically for those that are receiving services at our agencies. It's for those that are living lived people that are currently living with HIV, but also they are able to invite family and friends. So at that event, we provide, food, and there's sometimes a speaker, a special speaker that shares their story. We've also had some entertainment, and then we also have resources available. Last year, we had also testing available as well. We collaborated with Metro Health. So it's like a huge event for our clients. So that's also a way that we engage, provide engagement, also providing awareness and testing as well. So those are some of the little things that I've been a part of and been able to see how we utilize that.
Thank you, Rose. Yeah, just, the importance of really getting out into your communities, leaving our office spaces, getting away from our desk and actually talking to folks where they're gathering, the events that they have. So that's really great to hear. Thank you so much. Is there anyone else who'd like to share with us? All right, well, if anything comes up, definitely pop it in the chat, but we will keep on going. Next slide, please. And then before we close out, I just wanted to share some resources with you all. All of these resources are linked. And again, the slides will be shared so you have access to that. But first, we have a few NASAD resources that we wanted to share and make sure you all know about. So our first is our Re-envisioning Community Engagement Toolkit. If you haven't looked at that yet, I would really encourage you to do that. It's a great toolkit. I believe it was released in 2022. But I love that it's interactive. There are videos in it, worksheets. But I really appreciate too, it's broken into sections by population. So if you were looking to engage with rural communities, there's a chapter on that. If you're looking to engage with youth, there's a chapter on that. Black women, people who inject drugs, and more. So if you haven't been able to look at that yet, I'd really encourage you to do that. We also have our NASAD Community Engagement Resources landing page where we have all our other resources we've developed uploaded there. We have a talking points guide if you're facilitating stigma conversations in your jurisdiction. Even with providers, that could be a helpful tool. And our health equity team created a community engagement curriculum. Some other resources we have, there's a Trans 101 e-learning course, Acknowledging Gender and Sex. Jose mentioned the Let's Stop HIV Together CDC campaign, and these last few links are the ones that Heather shared in her presentation. So the Love Live campaign, both in English and Spanish, as well as the Las Vegas TGA website. Next slide, please. And I always want to end this with thank you so much for attending today, for giving us your time, for giving us your energy, for participating. I've really enjoyed this hour together. I really hope you all did as well. And just thank you to Heather and Jose for sharing your knowledge and your wisdom with us. Just really appreciate all the work you all are doing in your communities. Again, this is hard work, so please take some time to take care of yourself as well and really celebrate those successes and those wins, even if they seem small. A small win is still a huge feat, and it gets us closer to our goal. If you have any questions or need any additional technical assistance, definitely email us at ehcskip@nasad.org. And of course, because we're NASAD, we have an evaluation survey. I promise it is brief. We have a QR code here on the screen, or my colleague Sarah just linked it in the chat if that's easier. It should take no more than 2 to 3 minutes, but we have many more webinars coming. So we'd really love your feedback to know if this is meeting your needs, if there's anything we can do to improve, because we just want to make sure that these are useful to you all, that your time is well spent, and that we're meeting the needs that you have. I also want to plug really quick, we've been doing outreach with many jurisdictions. We have a survey for your EHE innovations. We are building out microsite that's going to highlight all the different innovations that have been implemented across the country for EHE. My colleague Brittany just dropped out that in the chat, but if you haven't begun to work on that, I would definitely encourage you to open it and bookmark it, and let us know if you have any questions. We really want to highlight all the great work you all are doing in your jurisdiction. But again, thank you all. I hope you all have a great rest of your day. And if there's anything we can do to further assist you, support you, definitely don't hesitate to reach out. But I also want to leave some time for my co-presenters, Heather and Jose. Any closing words?
Go ahead, Jose.
Thank you so much for your time. I think that, time is something that I could not get back to you. So I really value your time and your attention today. Please continue to do the work and remember that we together as a community can end the HIV epidemic. Stigma and discrimination can only be fought together. So please come and join the communities. Just like you said, if the community is not coming to us, we can go to the community and make things happen. Love always win, and keep in mind that we all are important and loved in our communities. Thank you so much. Enjoy the rest of your day.
And thank you again for your time too. I echo everything that Jose said. I truly believe that if we all work together, we can get exactly where we want to go. If anybody wants some extra support, ideas, feel free to reach out. I have a full presentation on how to align your team around a strategy for community engagement, not just with people with lived experience, but also other folks in the community as well. So I'm happy to share that with folks if you would like.
Thank you so much, Heather and Jose. And thank you again, everyone. And we hope you will be joining us for our next webinar in the series next month. I believe is September 18th, 2 to 3 o'clock Eastern. We'll be talking about engaging clinical partners. So take care, safe travels if you're attending the Rhine Wine Conference, and looking forward to seeing you then.
Thank you.